So, good afternoon to everybody. I am Edith SALES WUILLEMIN, and I will present the project Relation, which has been done in relation with the CHU of Dijon, more specifically the Professor Devilliers, Béjot, Ortega, Moncoudian, Cotin, Binquet, and the specific support of Anthony Klein and Adrien Dollard. The objective of the Relation project is to analyze the social representation of the healthcare provider-patient relationship among patient on one part and healthcare providers on the other part. This objective, the second objective of the Relation project, is to analyze the relation with the healthcare provider working conditions and mental health, like stress and quality of working life, and second, the consequences on patient education. For example, behavior intentions regarding health good practices. We know now that the quality of communication, particularly a reciprocal and dynamical relationship between healthcare professional and patient, is important. That is to say that a good level of physician-patient communication increases satisfaction, patient quality of life, patient's participation in decision-making, and decrease anxiety. Now, studies have well demonstrated that the daily management of disease involves the patient's active participation in the treatment. But it presupposes that healthcare professionals not only share a part of their knowledge and technical expertise with the patient, but also include the patient representations. But how can we define the social representation? We know now that it is a system of thought containing ideas, values, and practices which refer to common sense and everyday thinking. These representations are shared by a member of social group about specific objects, that is to say, socially significant object which have a very importance for the group. But social representation are differing from professional representations. For example, the healthcare provider group share representations about significant objects like illness, compliance, or therapeutic treatments that differ from those of patients. For example, therapeutic treatment evoke pharmaceutical form, dosage, drug interaction. But for patients, they evoke have a bad taste or have a pink color. This knowledge is for the professional, technical, and it includes in the team's task environment in order to share a consensual view of work and decrease risk of conflict. That is why we examined the cross representations. We now know that a good relationship and communication has an impact on the patient. But what does a good relationship between healthcare provider and patient mean? It is the aim of our study. We measured the cross-representation of healthcare relationship between healthcare providers and patients. We made two general hypotheses. First, we took into account that each group formed its own representation. Then, we hypothesized a gap between patient social representation and healthcare providers' professional representation. We hypothesize that in the representation of healthcare relationship, the patient is looking for a unique and special relationship with the healthcare provider, whereas the latter is seeking a transfer of knowledge and guidance of the patient. The methodology divides the participants in two groups. First, healthcare providers, and then patients. The methodology is in two steps. First, a qualitative step with interviews about healthcare provider-patient relationship and communication, and phase two in quantitative questionnaire. The data collection took place over a period of 4 weeks, maximum within each of the 5 hospital departments. From their admission to the department, patients were interviewed over a 4-day window. It was the same procedure for interviews and for questionnaire. I will now present the interviews analysis method. The analysis is divided in 2 steps. First, we realized a content analysis. Second, we made a structural analysis. Some contained in the interviews, which is based on, are analyzed with a statistical software and in a correspondence factorial analysis. Then a lexical analysis have been made. We analyzed correlations between words, that is to say, word network. Concerning correspondence factorial analysis, we can show that there is an opposition between, on the left, on the one hand, physicians, and on the right, nurses and patients. The physicians consider that healthcare relationship allows the patient to be informed about evolution of his sickness. It allows the physician to resolve problems, answer questions, use diagrams if necessary, and finally to explain in simple words. Nurses evoke that healthcare relation convince the patient, provide support, and take care of the patient. For patient, healthcare relationship is to be kind, to be available, to build trust, to understand, to listen, to reassure. We can say that there is an opposition between message and recipient, and on the other hand, between emotional and rational communication. Similitude analysis show correlation between several words. An opposition between physicians and nurses. For physicians, the central core of the representation is around healthcare provider. It is a self-centered representation. For nurses, the central core is relation and patient. It is an heterocentric representation. Now, consider the patient. They are separated in 2 groups. The first group, relationship is secondary. For the second group, the relationship is essential. For the first group, central core is patient and healthcare provider. The words are physician, treatment, and hospital. For the second group, central core is patient and healthcare provider, and the words are confidence, physician, explain, treatment, and illness. In conclusion now, for physicians, the relationship is defined in a rational and informative way, centered on the message. For example, a physician said, the physician has to get the information he needs He must listen to what the patient is saying and what he tries to provide answers and solutions. But for a good relationship, the patient must have confidence in their physician. It can't work if the patient doesn't trust his doctor. The relationship is, however, centered around the physician. For nurses, the relationship is defined in a relation way centered on the care. For example, a nurse said, if there is no relationship, there is no trust, and if there is no trust, the care will not be done as it should be. They try to understand the patient expectations and representation to build trust, and they evoke the relationship by positioning themselves from the patient's point of view. For patients now, for those who perceive the relationship as secondary, this patient look for the competence of the doctor, a serious doctor who does his job well, who has no doubt, and who knows what he's doing. Patients don't want to worry about their hospital stay. They want the good care and the right information, even if the relationship is not very good. For example, it is true that my doctor has a bad temper, but he knows his job. Relationship perceived as essential, these patients consider that a good relationship is a relation of confidence. It allows the patient to ask questions in order to better understand illness and treatment. A good relationship helps and reassures the patient. It allows his worry. A good relationship allows the patient to tell when there is a problem and when he doesn't agree with the physician. And what is the next step of the study? It's now well established that the relationship can be seen as the main ingredient in healthcare, particularly because relationship is a source of reassurance and social support for the patient. It reinforces the patient's self-confidence. For healthcare providers, good relationships with patients increase job satisfaction. Furthermore, healthcare professionals are able to perceive problems earlier and give better support. We now proceed in questionnaire, and we are hoping to analyze working conditions of healthcare providers and their impact in the relationship with patients. We will now answer the questions. If you have any questions, then please let me know.
Well, thank you very much for this very nice and I think very timely presentation in this time of epidemic. And maybe I should ask the first question. Do you plan to study how the coronavirus epidemic is affecting the relationship between patients? I think it would be a very
it will be very
nice study to do, and very important
measures
to do.
now.
Yeah.
Yes.
Okay. So, are there any some questions?
Thank you for your presentation. Did you observe any differences between the, let's say, young physician and old physician? I mean,
yes, qualitatively, yes, but it was just interviews. I will measure that in questionnaire, and I think there is a big difference.
Yes, another question.
Okay. Thank you. I hope I didn't mean something, but you were talking about, concerning the patient, you were talking about the stay of the hospitalization that was rather short. Did you observe any difference with patients that were hospitalized for chronic disease and that had a longer stay, perhaps a modification in their perception in the relationship? Thank you.
Thank you. Yes, there is a big difference between patients who are here for chronic disease and patients who are here for just a short stay. But in the interviews, we didn't measure that. We will measure that in the questionnaire in the next steps, and we will do statistical comparisons.
Okay. No more questions. So
okay, so
we should move on. Thank you again.
Thank you very much.